Hi, we're here with Tina Fiebelkorn, independent consultant pharmacist in the long-term healthcare setting. We just have a couple questions for her. The first one is, what is your role as the pharmacist or drug expert in the long-term care setting?
Well, ASCP, the American Society of Consultant Pharmacists, has always used a quote, and I apologize because I don't know who came up with this quote, but I always used it as the summary of what I do, and that is, as the medication expert, I am the person who identifies, corrects, and rectifies and prevents medication-related events. My responsibility in the nursing home or long-term care facility is medication therapy. So that starts from the initiation of the prescriber writing for medication all the way down to the delivery from the pharmacy to the storage in the nursing home and to the administration by the nurses, as well as the outcome of that medication. So I like to think that I do have a very crucial role in terms of not just safety, but the hopefully positive clinical outcomes for our residents.
And speaking of positive clinical outcomes, in this setting, how does your role as the drug expert impact overall patient healthcare costs?
Well, I guess you can look at it, or at least I look at it from two ways. One is a formulary standpoint that, you know, you can massage that drug bill to get the cost down. And one way of doing that is there may be a particular agent that can be just as effective but less costly. The other aspect of it, which I think really has a bigger impact, and sometimes it's not as well acknowledged, is that you want to look at the overall, how it impacts the overall health care. So it comes from healthcare costs. So for example, urinary incontinence is very common amongst the elderly. And there are multiple medications that can impact on urinary incontinence. So if you looked at it in a long-term care setting, a resident who is incontinent, they have very fragile skin, so they have skin breakdown. And then what happens is, you know, we have to push the nutrition, we have to pay for wound care costs, the laundry, the staff to take the time to change the laundry, change the bedding, you know, bathe the resident, redress them. So there's lots and lots of other hidden costs. So I'd like to think of it as you can identify lots of other issues from a clinical standpoint, and it impacts from a domino effect that it there's a bigger arena of healthcare dollars that you may not see in the drug bill, but you'll see it in other areas that may not be as obvious. So that's the way I like to look at that for the costs.
That's interesting, because some of those things are not things I would think of right off the bat that
Right.
the pharmacist would have a role in. There's been some talk about algorithms possibly replacing pharmacists and some of their role in some of the decisions that are made regarding the patient's health care. Do you have any thoughts on that?
Yeah, I do. I think, first of all, I don't think computers will ever replace the human mind. That clinical training is really pertinent to decipher, to tease out information that really determines whether or not it's medication related or not. And every particular individual is different. So when I do a medication regimen review, I look at it from a very individual standpoint. You are totally different than I am. And same goes for an 85-year-old who's living out in the community and has a very active lifestyle versus an 85-year-old who's living in a nursing home facility that is near end-stage dementia. You're not going to be able to take that algorithm and apply it necessarily to the same. The other thing I think with geriatric care is that most drug studies don't include the long-term care population. So how, you know, you're talking about the majority of our residents are over the age of 85, and most drug studies do not include that age population. So how do you extrapolate that information? You may not be able to. So it does take a lot of clinical skill in terms of knowing your medications, knowing the disease process of the elderly population, the care setting that you're in, because your approach may be different if you're dealing with somebody who's in assisted living. I also do medication therapy management for the community, and it's a very different approach. Actually, it's interesting because I actually take my nursing home background and apply it kind of in the opposite direction. How do I keep these people out in the community and extend their stay out in the community versus being admitted into the nursing home? So.
Wow, it's a lot to digest. Thank you very much for your time, and I appreciate your thoughts on these very important pharmacy matters.
Thank you.
Thank you.